curated a series of 4 policy labs which look at the intersection of the urban poor communities and WASH in the time and in the context of the COVID-19 pandemic. Over the series of 4 policy labs, we look at different thematic areas. In the first one, we looked at how local governments have responded so far to WASH in urban poor communities. In the second one, we deliberated on how urban resilience frameworks and interventions look at WASH and urban poor communities. And today, we'll talk about how communities have successfully managed WASH services for themselves. And finally, in the last one, which is scheduled to be held on December 9th, we'll see how WASH financing can better incorporate the concerns of urban poor communities. Before we move on to the opening remarks of the session, I will just lay out some key housekeeping rules. Please use the question answers box to pose your questions to the panelists. If you are attending the session through YouTube, you can also send us your questions at sci-fi@cprindia.org. The session is being recorded and we will share the recording and the slides from the session to all of the attendees towards the end. With this, I pass it on to Dr. Anita Manandhar for opening the session.
Okay, hello. Welcome to this Policy Lab and Community Approaches in Managing Water and Sanitation Facilities. I'm happy to be with you today. I am Anita Manandhar, Chairperson of Lumanti Shelter Group for Shelter, a support group for shelter based in Kathmandu, Nepal. I would like to take this opportunity to say a brief about Lumanti, which is established in 1994. And since then, we have been working with the communities, supporting them to address their issues related to housing, water and sanitation, economic empowerment, and concerned issues. We are very pleased to partner with Center for Policy Research and Sci-Fi, UNICEF, WaterAid, and Alliance to organize this Policy Lab 3. In the context of COVID, there is the need to improve our own understanding on how poor people on the ground are struggling for better access to water, sanitation, and other basic facilities. Today's discussion is divided into 2 parts. The first session will take us aware about the global and regional policy scenario, while the second session will highlight the community's initiations and innovations in dealing with WAS and other basic needs. We know that the poor communities, the informal settlements, have been deprived of accessing water and sanitation facilities for so many decades, showing various limitations. As time passed by, we see some changes and some projects initiated, but there is the need of sustainability and scaling up of the efforts, learning from the successful approaches. There is always a lot to learn from the communities. I am pleased that we have excellent speakers today, and thank you, Lasna, for organizing the speakers for this session. The academicians, professionals, and activists who have deeper understanding and practical experience from working with the people and communities directly. I would like to welcome all the speakers and the participants for this discussion. I believe we will have a good exchange of rich knowledge and come up with some directions to guide our future efforts. I wish a very successful webinar. Thank you.
Thank you. Can we go to the first session then directly? Thanks, Anita, for providing the context of the webinar. So the first session is today about the global and regional commitments and actions. So we have a very experienced set of panelists with us for this session. Let me introduce them to you. So we have 10 minutes presentation by 3 panelists, followed by panel discussion, where we also include other members. So let me first welcome Professor Bharat Dhaya, who is Director, Research Center for Sustainable Development and Innovation, School of Global Studies, Thammasat University, Thailand. He works on sustainable urbanization. He's the director of research center. He has got PhD in urban development from University of Cambridge. Then we have with us a second panelist, Mr. Bipin Dangol, who is also senior sanitation expert with Islamic Development Bank, Saudi Arabia. And he has 20 years of experience almost on sustainable sanitation and has very rich experience of working on implementation of humanitarian wash amongst many projects. His master's, his MSc, basically environment and technology from UNESCO IIT. And our third panelist is Anjali Kapoor, who works with Sanitation and Water for All to support civil society engagement in the Global Partnership. She works with Civil Society Network from Africa, Asia, and supports them in strengthening their advocacy strategies around WASH. She has worked on human rights and climate justice, and she's also been a journalist in TV news channels across in India. Then we have three panelists. The first one is Ms. Kusum Athukurala, who's the chair Network Senior Advisor Sri Lanka Water Partnership. Then we have Ms. Sri Snani Sufyan, Senior Program Advisor and Strategist, Waru Commission, New York, followed by Ms. Ilva Schween, Program Specialist, WASH Swedish International Development Corporation. So I welcome all of you. I would request Professor Bharat Dhaiya to first go and come on this panel to present on People's Process for Sustainable Urban Development. Over to you, Professor Bharat Dhaiya.
Thank you. So colleagues and friends, ladies and gentlemen, greetings from Bangkok. First, I would like to congratulate all organizers for hosting the series of policy labs on such an important topic as urban poor communities and COVID-19, new urban wash priorities for South Asian governments. Secondly, I would like to thank the organizers, especially Ms. Anju Dwivedi and Ms. Lajna Manantar, for inviting me to participate and contribute to this third policy lab. Today, the title of my presentation is People's Process for Sustainable Urban Development. Community approaches to managing urban wash services is a highly relevant and topical subject, not only now during COVID-19 pandemic, but also during the so-called normal times. From the latest report of the Joint Monitoring Program published by UNICEF and WHO in 2019, we know that 1.8 billion people have gained access to basic drinking water services since 2000, but there are vast inequalities in accessibility, availability, and quality of these services. Further, 2.1 billion people have gained access to basic sanitation services since 2000. With regard to wash-related challenges, it is estimated that 1 in 10 people, which is about 785 million, still lack basic services of water supply, including the 144 million who drink untreated surface water. 2 billion people lack basic sanitation, among whom 3 out of 10 live in urban areas. Moreover, 3 billion lack basic hand washing facilities. These statistics underline the massive global challenge with regard to managing wash services. With these opening remarks, I would like to share and discuss with you 3 points on today's subject. These points are part of a paper that I am currently writing. These 3 pieces of knowledge, which I'm going to talk about, are here to stay. They never seem to go away when it comes to discussion on sustainable urbanization or WASH services in the world. First, the people and their settlements, which are served by community approaches to managing WASH services, are an essential part of the sustainable urbanization process. This is because of 2 factors. First, city is its people, as said Lewis Mumford. Without people, there cannot be any city. COVID-19 has reminded us of it beyond doubt. We have seen this very clearly during the pandemic when the streets were empty around the world and life came to a standstill. This is also emphasized by the 2030 Agenda for Sustainable Development, which discusses the 5 Ps: people, planet, prosperity, partnerships, and peace. Moreover, the low-income groups provide a number of services to the city and therefore contribute to the urban economy. Way back in 2009, OECD asked an important question: is informal normal? We can, with great confidence, say today that informal is normal, or informal is a new normal. Factor 2 is informal settlements or low-income settlements are an important part of cities. They house hundreds of millions of people around the world. The World Cities Report 2020, which was launched at the end of October 2020, informs us that in 2018, there were over 1 billion slum dwellers around the world, or 24% of the world's urban population. This means that over 1 billion people access wash services through community approaches and or individual efforts. This is a big challenge to sustainable urbanization. And this is a global challenge that cannot be just wished away. My second point on today's subject is that community approaches to managing wash services are a critical part of the overall process of sustainable urbanization. This is supported by 2 factors. Factor 1 is community approaches to managing wash services and support local governments to achieve inclusive service delivery in cities and towns around the world. These community approaches provide the last mile service in reaching the informal settlements where low-income groups, and to use the South Asian terminology, economically weaker sections of the population live. Thus, community approaches directly target the goal of no one left behind, which is the fundamental promise of the 2030 Agenda. Factor 2 is providing wash services to the informal settlements supports the achievement of Sustainable Development Goal 6. Ensure access to water and sanitation for all. Providing wash services to low-income groups in cities is part of providing urban services to all citizens. Operating and maintaining urban infrastructure for all citizens contributes to improving urban livability and maintaining environmental health. My third point today is how community approaches support the management and delivery of wash services to those who need them most. And the answer to this question is through the people's process of sustainable urban development, or the people's process in short. Now, I would like to highlight 4 points about the people's process. First, people's process is scientifically proven method and a development support process. It is used on a day-to-day basis by millions of people around the world. The people's process, third point, is the people's process can be easily learned and applied. And finally, it can be easily taught to and utilized by people living in informal settlements. In fact, many people in this policy lab who are participating today have learned, developed, applied, and achieved phenomenal results in not only providing wash services, but also to building housing and developing and maintaining other infrastructure services. In the Asia Pacific region, as in Africa and Latin America, the people's process focuses on and utilizes the well-tested development methodology called community action planning. The application of community action planning includes a set of 10 people-led self-help sustainable development activities. And these 10 activities are: first, community mobilization; second, community organization; third, community registration with local governments or the government. Fourth, training of community members. Fifth, preparation of community action plans, and this includes specifying their technical, which is engineering and architectural aspects, and costing. Sixth is agreement with concerned local government and other governments for the implementation of community action plans. Seventh is community contracting. Eighth is community-led construction and management. Ninth is community-led monitoring, evaluation, and reporting. And lastly, community-led operation and maintenance, without which these services fall after a project is over. The application of these community approaches may vary from city to city, from country to country, and across the developing regions of Africa, Asia, and Latin America. The practice of community approaches may seem to look different from place to place, but the principles in use are common. These important principles and practices of community approaches to managing WASH services need to be understood and supported and promoted further. They need to be integrated into the processes of WASH services delivery. All of that will go a long way towards achieving SDGs and keeping the fundamental promise of no one left behind. With that, I thank you for your kind and patient hearing. Thank you again.
Thank you. Thank you, Professor Dhaya. Now we move on to our next panelist, Anjani Kapoor, sorry. Anjani, do you have your slides to present? Because we have also the presentation from your colleague, but you want to run it if you have other presentation?
Sure. Yes, I'll just do that. Thanks.
Thanks, Anjani. Welcome. So Anjani is going to speak on the government's commitment and accountability for achieving WASH for all. Welcome, Anjani.
Hi, everyone. Thanks for having me. Can you see my slide?
Yeah, sure, we can. We can.
Okay, wonderful. I'm just going to stop my video 1 second because I think there's some problem. Can you all hear me well?
Yeah, we can hear you.
Yeah,
okay.
We can hear.
Wonderful. So thank you for having me. As Lajana and her colleagues introduced, we work together at a partnership called Sanitation and Water for All. I'll be taking you through the mutual accountability mechanism, especially accountability, which is at the heart of our partnership. And that's what our partners, especially the civil society constituency, is aiming to ensure and achieve. Once again, thanks for having me here. My colleague was also planning to join, but she has some health issues. So you have me, and I'm here based at WaterAid in London. So quickly, without delaying, I would like to start the presentation.
Yeah, Anjani, just a request, can you make your screen full screen? It's not
Yeah.
coming. Yeah.
Sure.
Yeah. Yeah, you please go on. Yeah, thanks.
Yeah.
Thanks.
Okay, wonderful. Can you all see my screen? Yeah, okay, sure. Definitely. So this is an issue close to our heart, but as we have started this 10-year marathon for the Sustainable Development Goals, it's important to reiterate that these are joint goals with government in the driving seat, and they have the responsibility for implementing the SDGs and ensuring that the related follow-ups are done. But if these processes are to be collaborative and if they are multi-stakeholder, then it leads to more effective and sustainable solutions. So accountability is at the heart of any such multi-stakeholder process. And as we say that at Sanitation Water for All Partnership, that accountability is really a two-way street. And that's the reason we call it mutual accountability. So let's quickly see what the accountability even means, and what like some people call it the buzzword, but it is at the heart of any multi-stakeholder process. So it means that those who are responsible, they accept the responsibility for their actions, but also their omissions, and accept that they are being called upon to give an account of why and how they have acted or failed to act, and adjust their policies and actions accordingly. So to dig deeper into how the accountability mechanisms work out at the national level, we did a study, and between 2017 and 2018, a study was conducted on the national accountability mechanisms for the implementation of SDG 6, especially the water and sanitation goal. This research was led by sanitation and water for all partners like Coalition O, and Water Poverty, Watershed, Water Supply and Sanitation Collaborative Council, WSSCC, which is now the Sanitation and Hygiene Fund. And all the key stakeholders were involved in this study, such as the governments, both national and decentralized, civil society organizations, UN agencies, academia, and also think tanks. The representation of private sector and trade unions was slightly limited in the study. So basically, why this study was done, it was aiming to evaluate the nature of existing national accountability mechanisms, as well as the challenges and opportunities, with specific recommendations on how SDG 6 gaps can be plugged. So that was the idea of the study. I have left the link in the PowerPoint, which I can, or Lajana can help me share later. We'll come back to the study in just a little bit, but what sort of accountability mechanisms exist, first at the global level and then at the national level. So at the global level, there are these meetings of the United Nations high-level political forum, which usually happens in the summer. And these meetings usually build on the voluntary national reviews from the country, and the accountability mechanisms for international SDG 6 commitments, as I was saying, that it is based on voluntary national reviews from the country. It is voluntary in nature, without the guidelines, and are sometimes viewed as non-transparent or unfit for purpose. So that's the mechanism which is for tracking the accountability structures at the global level. However, it is voluntary in nature. And as you all will know, coming at the national level, every country has its own set of institutional structures to report on for the achievement. And they are, again, as I'm saying, it's voluntary in nature. So the entire accountability mechanism for now is voluntary in nature. However, I wouldn't go into the details of it. Some of the obligations are definitely tracked by the human rights law and guidelines. So just moving on back to the study as to what we actually found. So the sample size for the study was 25 countries. And as I said, that there were various stakeholders who supported the study, from governments to the academia to civil society. And what was actually found through this study were various challenges, especially in connection to the accountability mechanisms. So first, it really highlighted that the accountability mechanisms are not systemic. They are not regular, that is, it doesn't happen every year, and it's not very meaningful, that is, it does not involve all stakeholders when the government obligations are being reviewed and reported on. So that's one of the biggest challenges, that there's a lot of irregularity in it and it's not transparent. The second key challenge that the report highlighted when it comes to accountability mechanism is only a handful of countries said that there are accountability tools like grievance and enforcement mechanisms or a third-party validation. Then the third biggest challenge was there was inadequate reporting on SDG 6 from government side. There's no regular process for reporting back on their obligations related to the Sustainable Development Goals. This also limits the capacity of the civil society organizations to contribute and submit some independent reviews. However, these independent reviews happen as shadow reports by some of the CSOs in the country, but that, however, is limited. And then the last is in the 25 countries that we surveyed, the data was incomplete, especially in connection to what kind of water and sanitation services are available at not just the national level, but also at the rural level. And then there was an urban-rural divide in this. The data was not disaggregated enough, which allowed for tracking of the most marginalized communities like the indigenous groups, the refugees, the elderlies. So having said that, there are challenges to these processes not being regular, not being transparent or inclusive, not having like a third-party validation, but there are definitely certain opportunities, as we say at Sanitation and Water for All, that if there is enough focus on multi-stakeholder partnership, if that can be strengthened, it improves the relationships between all stakeholders at the country level. And if these processes, these accountability processes are participatory, it also helps in evidence building from the ground. That's something that the SWA civil society partners are focusing on. And when these processes are inclusive, it also helps bringing in more funding for SDG 6. So that's where the SWA comes in. At SWA, we've launched, actually, let me take a step back because many of you won't know what SWA is. It's a multi-stakeholder partnership, which is hosted by UNICEF. And it has 5 constituencies in it, and it's a government-led partnership. So we hold at the crux of it that the mutual accountability, which I mentioned a while back, is very important, that these constituencies like government, civil society, research, learning, private sector hold each other accountable. And how we do it at SWA is we have a framework in place called Mutual Accountability Mechanism. It helps holding partners accountable to each other. And basically how it works is it basically builds on the national level commitments for delivering the SDG 6.1 and 6.2 targets. And how these commitments are built up, they are basically from ground up with different stakeholders involved at the country level. However, not all countries, not all our partners are doing this in multi-stakeholder level, and that's what we are aiming to do. We feel that the mutual accountability mechanism can really help address this gap. Just quickly, hello?
Anjali, you have about 2 more minutes left.
Sure, I'm actually just gonna wrap up because it would be great to have some questions from, especially on this. So as I was saying that how mutual accountability mechanism works is partners make commitments. These commitments are based on their national planning cycles and review. It is multi-stakeholder in nature. And each constituency can take commitments to support government commitments, and the process for reviewing and reporting back again is based on the national processes. However, We have some high-level meetings that happens. We just concluded the finance ministers meeting in Asia yesterday, which brought forward some key gaps, but also helped some partners like Asian Development Bank take some commitments. And I'll just wrap up here. And if there are any questions, I will take them forward. Thank you so much for having me again. Back to you.
Thank you, Anjani. Thank you for providing this overarching framework for the global commitments and how the countries have to make themselves accountable. And it's not just the government, though the government is at the driving seat, but then there are various stakeholders which are also engaged here. So thanks for this context. Now we move to Mr. Vipin Dangol, who's a senior sanitation expert in Islamic Development Bank, Saudi Arabia. Mr. Vipin, I would request you to present on your Islamic Development Bank's approach and priorities on meeting SDG WASH targets.
Thank you. Thank you very much, Anju. And I'd like to thank the organizer, particularly Ms. Lazna Manandar, for giving me this opportunity to share some of the Islamic Development Bank's approach and priority on SDG WASH targets. And I'm very new to Islamic Development Bank because I joined there recently, 7 months ago. And before that, I used to work in Nepal in NGO called the N4. So many of the things is also new to me, but my presentation is categorized in three aspects. One is let me give you the overview of Islamic Development Bank and how we are operating and what we are doing. Second one is what is our overall strategic framework, and third one is what is our approach and priority in WASH in terms of SDG 6.1 and 6.2 targets. So Islamic Development Bank we established in 1974. We are headquartered in Jeddah, Kingdom of Saudi Arabia. Currently, we are in operation in 57 member countries from Middle East, Africa, Asia Pacific region, South Asia, Europe, and South America. And we have 9 regional hubs throughout the member country, throughout the regional map you can see there. And there will be new openings soon in Suriname, UAE, and Uganda. Please click. Next, please. So our priority is human development, agriculture, rural development, and food security. And also our priority is in infrastructure development, basic infrastructure services, private sector engagement, and science, technology, and innovation. We are promoting a lot, and we are doing research and development in Islamic banking and financing. And also we want to foster collaboration among the member countries in the trade and commerce. Next, please. So our mission statement is we are committed to poverty eradication. Our approach is again human development, and also promotion of science and technology, and also promotion of Islamic banking and finance by fostering cooperation, collaboration among member countries in collaboration with our development partners. Next, please. So Islamic Development Bank is committed to SDG goals, targets, because this is fully in line with our principle and objectives. So that means it is inspired for human dignity and also to leave no one behind. This is the core principle of Islamic Development Bank as well. So we recognize that different country has a different development objectives and priorities. We take this in due consideration while developing our strategy and plan targeted to the member countries. Next, please. So again, to realize the SDG goals and development agenda, we follow the collaborative approach, And we believe in partnership with bilateral and multilateral development financing institutions, private sector, and civil societies. Next, please. So this is the overall 10-year strategic framework of Islamic Development Bank, and which again you will find it is quite aligned with the SDG goals. Our strategic objective is inclusiveness, connectivity, and IFS growth. And our strategic pillars is capacity development at different level, economic and social infrastructure development, private sector engagement and development, and inclusive social development, cooperation between the member countries, and promotion of Islamic finance and development. Next, please. So for this, recently, the bank has adopted the new business model. We call it GBC, Global Value Chain Based Model. And we have developed a methodology and a published guideline called Making Markets Work for Development, which aims to reorient development operation to drive competitiveness of member countries' strategic industries. And it is based on totally based on the national growth strategy. So we have a quite rigorous consultative process with the member countries, particularly with the government and key stakeholders, while doing the global value chain analysis. And based on the global value chain analysis, we support member country to develop member country partnership strategy, which is a 3-year strategy based on which we develop our projects and programs. Next, please. So again, this is the triangle of Islamic Development Bank's value chain approach, which consists of broadly three components. It's a natural potential, which is based on the comparative advantage of the industries. Dynamic potential is a kind of forward-looking approach, and surplus and spillover potential is maximizing value add potential in the industries driven by forward and backward linkages. Next, please. So based on this, we have developed several sectoral policies. Among them, I'll be highlighting two sectoral policies within the bank, that is water sector policy and urban sector policy. The water sector policy, it comprises of 5 policy pillars, and this is also quite aligned with SDG goals and also with our 10-year strategic framework. And the overarching goal is sustainable and resilient water and sanitation system for all. And one of the pillars is universal and affordable access to water and sanitation. Next, please. Which we target to provide safely managed drinking water and sanitation services as mandated by SDG 6.1 and 6.2 targets. And with this, we also want to focus on vulnerable groups, including people living in fragile conflict zone and violent regions. Next, please. And another policy is we recently developed and approved by board is urban sector policies, and the goal is inclusive and sustainable urban development, which is in line with Sustainable Development Goal 11. And one of the key policy pillar is urban water and sanitation. Next, please. Within this pillar, we are focusing on providing safely managed drinking water and sanitation services in urban areas, as highlighted by Professor Bharat in his speech. Urbanization is haphazardly happening all over the world, particularly in developing countries. So the need of safely managed water and sanitation services in urban areas is very high, and we recognize that issue. And for that, we need to do things differently. And we believe that we need to promote and implement innovative water sanitation and hygiene technologies, behavior change, and management approaches to name few SCADA system for water utilities, sanitation transformative technologies combined with fecal sludge management, non-sewerage sanitation technologies, and so on. This particularly, we are promoting citywide inclusive sanitation framework in collaboration with Gates Foundation. Next, please. I'll be highlighting some of the few collaboration we are having. For example, with UN Habitat, we are collaborating to provide the basic services, including wash in informal settlement in the Arab region, and we recently published the report highlighting the need of informal settlement in Arab region, and based on that, we already received 31 application for the collaboration from Arab municipality within this program. Next, please. Another, our partner is UNICEF, and with UNICEF, we have been collaborating since 1976. And recently, we launched the Global Muslim Philanthropy Fund for Children. And this fund will be utilized to support the program, particularly for the children in emergency, but their education, health, wash, nutrition, and young people in employment. So wash is, again, another big priority within this project. Next, please.
Mr. Dongal, you have 2 minutes.
Okay, thank you. Another recent collaboration is with Gates Foundation, and we have the shared commitment to realize the SDG 6.2 targets, that is safely managed sanitation systems. And within this, we are working within the framework of SheWise, focusing on FSM and non-sewerage sanitation option. Again, adoption of transformative sanitation technologies. Next, please. And within this technical framework, we recently conducted the independent evaluation of sanitation project in Indonesia based on the request from BPNAS, government of Indonesia. The SANIMAS is 20-year project implemented by government of Indonesia. And we just concluded this project. And after a few weeks, we'll be sharing some of the findings from this project. And we are also planning to have a kind of internal capacity building on SheWise and FSM. Next, please. My last slide is on the Islamic Development Bank COVID response approach. We have an approach called 3R approach, that is a respond, restore, and restart. Respond is kind of immediate and fast actions, assist member countries to respond and mitigate negative impact of COVID pandemic. And restore is kind of a mid-term actions to strengthen the health and economic systems. And restart is the kind of long-term actions and strategy to start the economic development at the member countries. Next, please. And for this one, we have already have a 2.3 billion of funding package, out of which a lot of funding has been already approved and dispersed, and some of the funding will be dispersed soon. And you can see in the health sector, which also include WASH, the significant amount of funding package is there. Next, please. Thank you. Thank you very much for your kind attention. Thank you.
Thank you, Mr. Bipin. Thanks, all the speakers. We can go to the panelists. So just to also, give some lead to the panelists to have this discussion on, I just wanted to say that, these global commitments, whether they were SDG and other country-specific commitments that were made, have been, badly affected by COVID. We all know that recently the UN report of 2020 has said that it has really pushed back people. I mean, even if those achievements we could see in SDG have been pushed again back to margins. And almost, at the start of 2017, there were like 2.2 billion people who lacked safely managed water in the world, and 4.2 were lacking sanitation facility. After COVID, this is the prediction that the 2020 report says that it is going to affect 70 million people who will be pushed to poverty, extreme poverty, and 700 million people will be, could be displaced due to water scarcity. Now, looking at this emergency situation that we are in, how these global commitments can be then seen, and how do you sustain it, like what the efforts have been made. So I would like panelists to give some thoughts on all this, looking from where they are and representing which organizations and countries. And how do they see that how this can be fast-tracked to achieve what we had committed ourselves to? Thank you. Over to panelists. So I will request anyone to begin. Could be Kusum, Sri, and Ilva. Anybody can start. Yeah, Ilva, you would go first.
Sure, thank you very much. So my name is Ylva Schwinn. I work for the Swedish International Development Cooperation Agency from Stockholm. And it's a pleasure to be here in this seminar. I'd just like to reflect a little bit on the presentations that we've just heard, because I think the two former ones, they really speaks to the heart of what SIDA wants to do in general, but also within WASH, which is my area of working, because what SIDA does is based on the human rights-based approach, which include participation, accountability, non-discrimination, and openness and transparency. And these two first presentations really speaks to that. It was very interesting to hear Dr. Barat and his call for acknowledging the informal and the areas and the community participations that do deliver in this area in significant levels. And it's also it's a pleasure to hear Anjani and about, you know, the shifting on what accountability actually means and how to deal with that in practicality. I think perhaps for a further discussion, it would be interesting to see how these two are coupled. How do we reinforce the community participation and the efforts for the communities, but also making sure that there are accountability measures also for those efforts. And I think it was also interesting to hear from the Islamic Bank. I think that there is also resonance to what SIDA is doing on blended finance, how we strive to find synergies, but also particularly on what you also mentioned, the citywide inclusive framework. And I think that is something of particular interest to urban poor and informal areas. I heard you that you asked me now, Andrew, to talk a little bit how we can achieve the Sustainable Development Goal and how to fast track the efforts. And that is a really difficult question. I think perhaps what we've learned is that we've tried to fast track too often, and that doesn't lead to sustainable efforts. I think from our perspective as a donor, we already put effort into emphasizing the system strengthening, including corruption minimization, supporting accountability mechanisms, the rights agenda, environment and climate change concern. And these priorities haven't changed, and they cannot change due to the pandemic. Our commitment stands steady, but the scenery has really changed dramatically. And this emergency has exposed the constant urgency to assure WASH for all people. And to complement the other speakers today, I think I'd like to just mention a few points that we at SIDA as a donor look at right now, and where we think that we need to put efforts. And one of these issues is that we do recognize that WASH is raising as a health agenda issue, but that we are yet to see plans concretized and coupled with financial allocations. So there need to be ownership and steering on national roadmaps, establishment of standards and accountability mechanisms, as well as coordinations to effectively target interventions of public health, WASH, and nutrition. And another point is that we are concerned about out-of-pocket spending for water, which is a particular relevance for people in informal settlements. We know that regular subsidies, COVID support packages with reduced or dropped tariffs may not, or perhaps even seldom benefits this group. And we need to continue to work on subsidies and fair tariffs And in case where we try to stimulate new investments, incentive-based, results-based, or any type of investment to water supply, we need to make sure that these are well targeted, pro-poor, with particular attention to assure accessibility for people living with disabilities, and actively combat discrimination. And as Dr. Baharat emphasized, that a large part of the share to these communities are organized by community efforts. We also need to make sure how these new possible investments that we seek can also be made available to those. And I think there is a work to do there. I want to mention the critical delay of reopening the schools caused by unsafe wash. And this is an area that requires particular attention. And lastly, I'd like us all, perhaps all wash advocates, to seize the opportunity in regards the focus and the debates on disrupted routine vaccination programs. The disruption is catastrophic and needs to resume as soon as possible, but safe. And to truly bounce back better, I think it's central that both adequate access to wash and resumed routine vaccination is assured. In the event that vaccinations needs to be seized again at some point, at least basic hygienic environment must be given the same priority, both in the living environments and in the healthcare facilities to protect children, parents, and staff. And I think opportunities may include new platforms for advocacy when this routine vaccination is up in the air, but also for restructuring vaccination campaigns or programs that to include hygiene components, perhaps in such a way that has been successfully done in Nepal, for example. And yeah, as already mentioned, the response need to be not to be limited to COVID infection control, but to assess long-standing issues of the rights to water and sanitation, and to also capture the ongoing epidemics and infectious diseases. And but lastly, I'd like to say that it's really encouraging to see fantastic capabilities to regroup and adapt and cooperate and seize opportunities among our partners. And I think this seminar is really an example of such seized opportunities. And I'm eager to listen to the rest of the presentations. Thank you. Over to you, Andrew.
So much. Thanks for your thoughts. Let me go to Kusum. Kusum, we cannot see you. Hope you can hear us. Are you able to hear us, Kusum?
Hello?
Yeah, now we can see you also. Yeah.
Okay. Well, at last. I've been struggling for the last 20 minutes trying to get in. Welcome to all of you virtually to my world of lockdown. I'm just coming out of my second lockdown and hitting a cyclone in the middle of it. So, ladies and gentlemen, water friends, it's so nice to see some of the faces I haven't seen for quite some time. And if we get to our point, which is urban communities, community approaches to wash services, it just struck me that watching TV for this last few months, that we may have exported our urban problem to the rural sector, because one of the activities that happened was that we had a lot of the urban informal sector, from the poorest to the poor in the slums, going back to their villages, which never had facilities in the first place. So this is something that, maybe which keeps striking me as I think about the inequities in the urban sector. Do we have the same group that started off when we were working in the month of February, or has the demographics and the numbers changed? I really appreciate Professor Bharat talking about the community approaches, because I feel that, when in this post-COVID world, we have gone back from our commitment to ground level, people-led, community-driven activities to we are forced into this stratospheric world of Zoom. And I fear that, unless we do something very quickly afterwards, we will be, we'll be very happy in our comfort zone of Zoom. And this is for me a major issue, because most of the errors that we have seen, in financing, in investment, came because of our inability as water professionals to gauge the necessity to look at community, what they think, what they want, what they really needed. So I think I really appreciate Professor Bharat. So as we also go into this world of iniquities, which is now on us, we are also looking at people who had lost their livelihood. So the tiny bit of money that they could spend on maybe getting a pump mended or buying water is already gone, because they have no employment. They haven't had employment literally in this place that I live in called Colombo. The urban sector has not had anything to live on except for 2 months. And even now, Colombo is a patchwork of green and red zones. So there are people who can live in a green zone, but really they were working in a red zone. So what do they do? So it's difficult for us to make any kind of system, any kind of program in such a situation. I would like to go back to Anjali, who was talking about the finance minister's commitments. Now, are those commitments going to stand in this COVID-driven scenario? Are we going to have a situation where, which is what I feel in my country and in many of the countries in which I have linkages, that we are being now totally pushed by a COVID-driven agenda, in spite of the fact that we have been saying for the last 25 years that hand washing is important. Suddenly, that is not on the agenda. SDGs are not on the agenda. And I believe that, this is something that we will have to work on, at least when the COVID impact is lessened. Hopefully it will. So how do we go back to this agenda and make sure that we have not lost the financial commitments? I would like to go back here to a very far away to the year 2000 in The Hague, where the World Water Forum said that we should have accessing political decision makers as a priority goal. And unless we do that, I believe that the best intentioned bureaucrat cannot make any headway. We really need to convince political decision makers. We are all the converted. We all know what should be done. We know what we want done. But do these people who control the budgets know what should be done? Can we make them champions and get them on our side, more or less, our side, if you want to put it that way. And do I have more time? Okay.
Yeah,
and I would also like, if you can look up an activity called Women, Water and Climate Change, Tackling the Challenges, which was just, it's an activity funded by SCI, Stockholm Environment Institute. And if you look at that, I believe that, this is a case study of resilience, how a women's organizations got this big conference back in February, and we went through all these permutations of trying to change, trying to fit in with this corona environment, and to bringing to what it is now. And I believe that resilience is the most important thing that we need to be talking about for the next maybe 6 months. How do we build community resilience? It is not going to be by Zoom, unfortunately. We have to put our necks and our, ourselves on the line, because community approaches are more important now than ever before. Thank you.
Thank you, Kusumji. Very insightful. Community approaches, and of course, this resilience framework, which we lack in urban policies and program, need to be seen. And the last policy lab of ours focused also on this framework, disasters, how they ignore the resilience framework, and which is needed now. And of course, the community approaches have to be central. Thank you very much. And then we can move to Sri, our panelist. Sri, are you there? Hello.
Yes, I am. Thank you, Anju. Can you hear me?
Yeah, we can.
Yes, thank you very much for also inviting me to be part of this panel discussion. I think, so many, Yiva and Kusum already mentioned important points as well. And I like to bring to just take on the last point by Kusum about highlighting community approaches, and that is it is now more central. You see, when we talk about the global commitment that the SDG 6 is one of the goals that government sign on. But how many people actually, know that their government actually have signed on this? And that links back to accountability, that the accountability point that Anjani brought up. So this I'm not a AWASH specialist like some of you, but I think that this point about the community bringing the asking for accountability beyond at that high level of asking accountability. There are also smaller approaches that bring up accountability through report cards in the community, because I think some of us who work with community, and Huairou Commission is one of the global women's organization that supports grassroots level organization in over 45 countries with more than 120 members, grassroots, and its facilitating NGO. But one of the things that we bring grassroots women to the international level so that they know what are the policy commitments that their government make. Back home, they can ask for this accountability and also speak to them and look at possible partnership. I think those are the things that also, when we talk about community approaches, community being central, is community, and especially the urban poor, is not looked at as victims, but they are as partners in development. So this is one point that I think I would like to also bring up, and especially women, they are agent of change together with their community, and organized grassroots women are very strong group of people. Bharat's point about community action planning. Now let's link back also to the commitment on SDG 11, because this SDG cannot be seen in silos. They should be interlinked. And the issue of WASH is actually, we have to look at it at the interconnecting, that it is also linked to poverty reduction. When we have access to WASH, it links to poverty reduction, food security, peace and human rights, ecosystem, and education. Now, going back to the community action planning steps, in SDG 11, make cities and human settlement inclusive, safe, resilient, and sustainable. I think the report of that Anju mentioned just came out. The SDG report doesn't show much progress yet. However, I think we could link back with that point about accountability, which is part of the main characteristics of good governance. The implementation of the new urban agenda, which is seen as the blueprint for SDG 11, has a trust that call for national urban policies. Now, how do we bring this part about community engagement and all that as a characteristic of the new urban policy that will tackle also the issues of access to basic services in poor communities, in the slum areas, all that. Accountability mechanism at the high level, we have also, we want also to have accountability at the community level. The grassroots women and the community have done mapping. And through that mapping, they know who have access, who don't have access, how much people pay, how much others are paying, and through the formal and the informal process. Because we know in WASH, the poor people pay more for water. And right now with this crisis, when we first heard about pandemic, COVID-19 and washing hands and all that is very essential, some of our groups who lives in the community areas, these slum areas, says, we don't even have water to drink. How can we spare water to wash hands and all that? And this is the reality that some of us, we are fortunate to have, you know, a house, access to water and all that. But these are the things that I think we have to think about. And I think that will be also discussed in the next section. The collaboration between across level of government and the sub-jurisdiction, and also with the community, how to formalize that, how to make sure that they are recognized as partner of development. I think that is still a challenge that we all have to work with. Yeah, and Kusu mentioned about the inequalities or inequalities. Yeah, so and that becomes also a challenge to development and become the point for development deficit. And how do we understand inequalities and commit to having data gathering and utilize data also from the bottom up and not just, you know, the formal one. So I hope this rambling is useful and contribute to our discussion. Thank you.
Thanks very much. Speakers have to add anything. Just 1 minute I can give to them, and then we'll close this session. There was one question which we have answered, but if you, as a panelist and speakers, want to say that, you know, how to sustain these initiatives, even these things of hand washing and all that, even if they've started in the communities in more serious ways, how to sustain it is a challenge considering wash scarcity and other thing. I can give 1 minute to all three speakers who presented, and if they have anything to say, otherwise we can close this session and move to other session.
Yeah, thank you for the feedback. I appreciate the panelist views. I'm very happy that many of you share the perspective that communities' involvement will become central again after this COVID-19 bump. And I think it'll give us more challenges to go deeper and revive those community links and to work towards a brighter future. So I think I would just say that. Thank you.
Thank you. Anybody else? No?
Sure. So Anjani here. So thanks everyone. I think, as I was saying, that accountability is at the heart of the work of SWA partnership, but is also at the heart of any multi-stakeholder platform. And as Kassim was saying, that COVID is a huge challenge when it comes to sustainable development goals, and it also there's a threat that it can put our progress back. So, however unfortunate the COVID situation is, it provides us with like once in a lifetime opportunity to raise the profile of our sector, and SWA commitments are very relevant to COVID, and not just for COVID but also beyond. And as Kassim was mentioning about the commitments, so and how effective they will be in the COVID context. So as we all know that World Bank has estimated that we will require $114 billion per year to meet the basic access to water and sanitation needs. So to break this cycle, just yesterday we had a meeting with the Ministers of Finance, and SWA is trying to engage the Ministers of Finance in conversations that basically to make a business case for investment in the sector, because that would help the ministers focus on the impact of this sector, the impact that it has on the economic development of the country, but also for the health, environment, education, and what's the best time to do it, but when we are facing a pandemic. So thank you all, and I will just share an example of how our civil society partners are working to include community in accountability mechanisms. And I think it's a great read from Bangladesh, wherein CSOs are working with the communities at the Zilla, and so basically at the lowest tier of government, to bring in the community voice in the budgeting processes. They have advocated the local governments to print the budget on the walls of the office, so that community is able to see what is allocated to which service, and how much is being utilized, how much has been the release of fund, and when the fund is released in the budget cycle. So all that is printed on the wall. So these are some of the ways that CSOs are helping enhance the community voice and amplify accountability.
Thanks, Anjali. We are actually running short of time, so you can give us some links in this chat box and we can read. Thank you, everybody. We move on to the second panel. I would request Lajana to steer it.
Okay, thank you, Anju. I'm very actually pleased to hear the speakers. All the speakers actually spoke about the community's importance and the role of the communities, and putting communities in the central. So that's very pleasant to hear about. Now, actually in this session, we will hear from the community experiences. So from the speakers, we have been actually working directly with the communities. So we'll hear the practical experience, how the communities have been coping with the water and sanitation facilities. I think, so before that, let me introduce you myself. I'm Lajana Manandar, and I'm the Executive Director of Lumanti and based in Kathmandu, Nepal. So our first speaker, I think I would like to request to Maite Blenden to make a presentation. And Maite Blenden is from Guatemala, and she's the program coordinator of Guatemala Foundation. And she's very sensitive, very highly dedicated leader who has been actually working with the grassroots women's groups, communities for decades. So the floor is yours, Maite.
Thank you very much. I appreciate very much to be in this event, in this panel. As Lajana was saying, I was so happy, even that it's in my 5 a.m. in the morning almost, to be here and to be sharing with all of you what really means WASH at community level. As I'm also working in Water Commission, as Sri and Jokas, that is going to be listening later. So it's about how are we going to be talking about WASH, but also about water, as if we think that all relationships really are built around this system. If we start to see water as a system like soils and forests, this is something like we're gonna see really like an integral approach for development. And we need to start to see like that, because this is a system that really sustains lives. And especially my presentation is about what grassroots women leaders are doing, collecting water, but also collecting development with water harvesting systems. Can we go for the next, please? For example, if we can see in these pictures about coastal areas, what happened? I think this is an urban and like all WASH systems, but also if we can say that we have not, distinguishing right now about urban and rural, because needs are everywhere right now. And if we see that rainwater harvesting has been a vehicle for economic empowerment for urban and rural grassroots women, and a very important practice of community resilience building in Latin America. we have these water harvesting processes as one of the main important resilient practices we are conducting in Guatemala, for example, here in the coastal areas. Because if you think about our last recent climate events, like the hurricanes Eta and Iota in less than 14 days, we can see that communities that were collecting water and having in a high level because of floods, systems, they were not suffering so much about missing water or lacking water, especially during this COVID time that Sri was also mentioning. But it's because in these coastal areas, when the tide is so high, they cannot go forward out to get water, potable water to drink or to use. And then if they have, been collecting water from rain, they are using this for different activities and also for economic empowerment for women, because they are using to produce and to use this for having this resource, as for example, in the ecotourism places, they can then use and they can then produce and they can then be, empowering by themselves. If we can pass this, please. The next one. Access to water harvesting represents also a right to the city for women. If we see about, the right to the city, and then the global platform for right to the city that the Water Commission is also a member, we can see that that some of the areas in the urban communities, they are not having water, potable water. So we are using these systems to build a right and to come to the local authorities to say, please, we need to start doing this in a different way, because we need to be part of that. You see in the pictures, to cultivate the urban gardens for food security, for example. Next, please. In this case, indigenous women have been using, for example, has been able to establish for the first time urban gardens for food security. And then they were trying to collect water to preserve these urban gardens for crops irrigation, but they use also the water for health and sanitation, as you were mentioning, productive activities, as ecotourism that I was mentioning, amongst others. They can generate income because they can cultivate, vegetables to sell. They can, doing a lot of, like you see now in the pictures, they are doing a lot of different activities using the water they were collecting, because in the past they were bringing water from 2 hours from the community or the municipal, a fountain. So it was so much for them to carry going up the hills, and so much for them to being, saving some uses for the water, because they were not even to do a very important wash system in the communities. Next, please. This is something that was sponsored and it was funded by DPECO, the ECHO agency of the United Nations. And we were convincing them to try to do some of these micro projects, micro interventions in different communities that they were, for example, here is a school and there's a training center for women as well, very nearby, and they were missing water. So we were installing these 2 different tanks for water harvesting. And right now they are using this for so many educational spaces and systems, for having, different approach to development. Next, please. Yeah, for example, in our response to COVID-19, the mandate was, please go to and wash your hands. But in some of the urban settlements of Guatemala City or Latin America, I can say Lima, Peru, or in Brazil, in the favelas, they were missing water, really. They were missing basic services to do this kind of sanitation and hygienical programs and processes to prevent COVID-19. And in the meantime that we were providing support to install water systems to harvest water, they were at least trying to share the water they were, collecting, like in this example, like this is a very isolated community near Belize border, and they were missing, like because they were in the middle of the sea, and they were only having salt water. So in this case, they were, able to have these systems, and they were, and there were, like a calculation that these are very, very cheap systems at community level. So now in Fundación Guatemala, in the resilience program, we are trying to go, like in a package, to have the water system, the collecting water and harvesting system, and then the tools bank, as well as the two main programs that we are facing. And they can include organic agriculture, they can include some other processes they need to install with the resilience, also in adaptation to climate change. Now we are going to project a little video on about how to say this was conducted not yet, please. I'm just going to introduce. This is a school. We are supporting the Let's Educate program, and as one of the resilience areas as well. And we were like trying to do jointly with the Asociación Actinamid, that is the one who's running this school, this Let's Educate the Girls program. And they were trying to, because we were, in communication, saying that part of the work they were doing in the communities, we were covering 800 communities in Guatemala to install this hand wash system for avoiding and to prevent COVID. So in this case, they were trained how to do it, and they were sending us the 800 videos for showing us how to do it and how they were working in community doing this wash process. You can project it now. There's no sound because it's in Spanish, but it's about, she's explaining how to do the hand washing process at community level, and they were in charge to install at least 10 of these wash hand systems, very traditional, in their community. So we were trying to serve to cover 800 communities at this very, like a low cost and very, effective in communities where they were missing wash systems. So this is what some of the homeworks they were doing to prevent COVID and to act and react on this pandemic. So this is something like we wanted to share with you what we are doing in Latin America on the wash processes, and I'm really very, very happy to be with all of you here because I'm learning a lot of different processes from the wash specialists, and hope that we can, have a nice discussion later. Thank you very much, and over to you, Legend.
Thank you so much, Maite. I'm so pleased to listen to you. I'm so pleased to have a look at this brief video and also the slides as well. Because you highlighted the importance of rainwater harvesting system, and the communities have been relying on that, not only for the sake of harvesting the water, but then I think that's the only source for them to rely on in the case of disasters, emergencies, as you have said. So how it has actually contributed in saving the lives of the people, in making the lives of the women much easier. So that's a kind of activity we need to promote, but then we don't see that is happening much. And also the very low cost kind of hand washing technology that you have installed in the communities, covering 800 communities or schools that you have said, that's the kind of activities is possible, because when we actually are talking a lot about lack of finance and there's no fund and finance, but then also important is how do we actually innovate how do we deliver a technology that is low cost and also very effective for the people to use it? So thank you very much, Maite, for sharing this very, insights into the community and how they are managing. And also thank you very much for being with us in this odd time for you. This is midnight. Okay, thank you, Maite. So now I think I will go to Pema Laki from Kathmandu, Nepal. And right, and Pema, she's Pema Laki is the executive director at Nepal Fertility Care Center based in Kathmandu, Nepal. And I'm very pleased to introduce you to her because she's the catalyst in the revolution on menstrual health in Nepal. So she's going to actually talk about the menstrual health management, and she calls herself a menstrual activist. So let's hear from Pema Laki. The floor is yours, Pema.
Thank you, Lajana ji. Good afternoon, good evening to everybody. And I want to start by thanking Lajana ji and Lomanti for providing me this platform. It is a new platform for a person like me and for an organization such as NFCC, because we are a traditionally reproductive health organization working in Nepal for 33 years. We started working on menstruation for the last, since 2009. So most of the conversations that we've been listening to have been interesting, but from very WASH perspective. So I hope that I'll be able to shed light on a slightly different perspective on how we have been approaching menstruation and working with communities in Nepal. Next, please. So I want to start with this photo, and I think a lot of the WASH colleagues who are here will see this and will obviously be in shock. This is the photo of a school that we have started working in the Midwest of Nepal. It's been about a couple of months, about early 2020 that we started working. And this was a photo taken during our survey doing a CAP survey in a school. When this photo was shared with me, I mean, I was appalled. Next, please. Because of all the trainings that we've been doing the hundreds of training, the thousands of products, the hundreds of sessions, the thousands of people we've been, running sessions for, the hundreds of toilets, the hundreds of water schemes that are made, and the numerous policies that are made had been advocated for by people in the WASH, in rights, not so much health. I mean, there are a lot of organizations that have been working on menstruation in Nepal, and yet this photo for me is a failure in what we've been doing. I'm not trying to say that we've not had advancements and we've not done, but in totality, this shows that there is something missing. Next, please. It shows that we have failed somewhere. And it really brings to mind that maybe we need to reflect more on how we're doing what we're doing. And for us as an organization, we've had to also re-educate ourselves about how the WASH approaches and perspective. We don't know as much as how all the colleagues here know and have worked in, but we've learned a little bit. And we feel that while WASH is very, very integral to menstruation and managing menstruation, but there is a deeper, there's a complexity to menstruation and how it is perceived. And if that is not looked into, I don't think any of the work that we're doing, the tangible work that we can see and photograph and, like number it and report, will actually make sense at all. Next, please. So one of the things that we've been doing at NFCC is really looking into what the community does. Community is obviously, as we all know, is very important. And we know that, and we all are part of the community, right? And the role of the community can be, two ways. It can enable, as we all know, and it can disable. And one of the things that the community has done, and I speak in reference to Nepal because that is our area of work and this is where we've been working, is that the community has enabled a concept of impurity about menstruation. And why is that important? Because that concept of impurity has resulted in all these numerous restrictions that have been indoctrinated, that we all know, and it's become so entrenched in our psyche and our perspective and our norms and the way we look at things that it has affected, next please, how the community has disabled, the restrictions have disabled. And so in a sense, the community has disabled two things. One thing, next please, which is tangible, is the access, and access to tangible things. And this is the part where WASH is a big player. It has disabled our access to toilets, to water, to materials, to mobility, and overall to education too, because we talk a lot about WASH in schools. And while these are the things that we are looking at, tangible stuff that we see, that this thing that community has enabled on the perspective of, on the concept of impurity and how that has disabled our access, there's a larger thing that it has also disabled. Next, please. And that is rights. And what it has disabled is this right to self-determination that at the end of the day, we as development workers, we need to ensure that is there and people are able to exercise. And when we do that, when we take that agency from people, from menstruators in the community, we actually take away the future, right? So we need to really, really, once again, go back to the drawing board. It's not just about that. You can build hundreds of toilets, but if you do not change the mindset that it is okay to use toilets, nobody's going to use it. It's going to be the same condition as the first photo we showed you. So next, please. So how can we change this? I think it's an important question that everybody will say, yeah, so how we can change it is the same thing. Okay, it's very difficult to change a lot of things. So let's look at the same thing. But next, please, we just switch it. We need to work at the community level so that the roles are switched, that now the community starts disabling this concept of impurity that it has been carrying all these hundreds of years, because only then the restrictions will start going less. And only then will the community be able to enable all of this directly and indirectly. And I think, and I don't mean to say that this hasn't been done. I think the WASH sector has made tremendous advances in terms of water and access, but we still have open ODF declared places where Chaupadi is practiced. And for me, that is a paradox. As a person who works, I'm a feminist, I'm a women's rights activist, I'm a menstrual activist, I'm a health person, I work on menstruation. It is a paradox for me. I am amazed that ODF can be declared in a place where we have proof that Chaupadi is being rampantly practiced. So I think we really, really need to go back, and it is difficult. And with all the WASH colleagues I've worked, WASH is a technical area and looked at in a technical standpoint, but we really need to start looking at it because menstruation in Nepal is layered, it's complex. And if we don't go and start working at that level, it's not going to matter at the end of the day. So what can we do? Next, please. So next steps. One of the next steps, so I'm going to tell you two next steps. One thing that we need to continue doing, and this is the remarkable work that has been happening all these years, and we need to continue doing trainings, but we need to make sure that it is standardized. We need to make sure that if there are 5 organizations informing about menstruation in the community, they all are saying the same things. We cannot confuse people. And that is the problem just now, that people are going and saying, if I menstruate, I think I'm able to educate another about menstruation. It is not. It requires a deeper understanding of perspectives. And that is why we are not being able to change. I think we also need to continue educating. And I think it's been tremendous, the revolution, and I think it's great. We need to continue. And this, again, the WASH sector has been doing, continue the access to toilets, the access to water, the access to materials, advocating for infrastructure, policies, and we need to start advocating against restrictions. I don't think that is done enough. And it needs to come not only from the rights, the rights sector, but it needs to come multi-sectoral, sort of advocating against these restrictions. Now, these things we need to continue, but we need to revisit and, as I said, go back to the drawing board and keep doing these things. But we need to integrate what I'm going to tell you next that we need to do. We need to start the most important, we need to stop justifying restrictions. I think if we want to work on menstruation, We need to stop justifying restrictions. And that is the number one way that we can change perspectives. I have heard too many people come and tell me that the 4-day, off that women get from the kitchen is a break. It is not a break. 4 days they are not allowed to go to the kitchen means 26 days somebody is making them go to the kitchen. And I don't understand why it is never seen as that and is never negotiated at that. So we as workers, we need to do that, and we need to sort of integrate these type of conversations into the conversations and sessions we do in the communities. We also need to integrate rights into these discussions. We always look at, oh, restrictions are bad. Why is it bad? We need to tell them. We need to have long, intensive discussions and engagements with them, but be able to negotiate with them. This is a very important point. We need to keep menstruators in the core, at the core of the discussions, at the core of whatever action happens. For example, back to the keep menstruators at the core is because supposing you build toilets. When we build toilets, what we've seen very few examples, or maybe it's also a lack of having access or knowing enough detail about it, but we need to see, are the girls in the schools being asked, where would you feel comfortable having the toilets? We like to believe that we know where it is best. And so we are not really keeping the menstruators in the core. Same thing like about the products. The government of Nepal, like many other governments, are making these loud declarations that, oh, now we will distribute sanitary napkins for free for all public sector school students. Did you understand whether that is what they want? Because that is again a bunch of men sitting and making a decision that, okay, pads are good, but look at the condition.
Just a second, we have time ending for you. Can you please go fast?
Okay, so we need to keep them in the core. We need to consistently focus on enablers. We've found that mothers are the ones who make their children follow the restrictions. So we need to do that. We need to focus on the mothers in the community. Next, please. This is my last slide. And we need to, as everybody's been saying, advocate for accountability from systems, from governments, from families, everybody. And at the end, of course, we need to ensure the right to self-determination for every menstruator in the community. Last slide. Yeah. This is the end of my slide. We are an NGO that, as I've already mentioned, we are very happy that we've been advocating. We advocated for repealing a holiday for women on Rishi Panchami, which is a day that government of Nepal wanted to give holiday, although they say that that's the day that you can ask forgiveness for defiling anything for menstruation. So we need to advocate more like those type of things by getting accountability from systems. I'm just going to cut my presentation, but this is the last slide. So this is just a few briefs about the organization I work in. And please feel free to contact us if you want to know any additional information about us and the work we do. Thank you so much. And once again for this opportunity and for listening to me.
Thank you, Tema. That's very a wonderful presentation, and I'm very glad to listen to this. I can actually sense a passion in your voice for the work that you have been doing. So thank you so much. All right, and also I would like to congratulate you for being, NFCC being selected as one of the best organization working on MSM. So keep it up. Congratulations. So our next presenter is Josephine Castellino. Josephine is the program director of DAMPA, program manager of DAMPA organization based in Philippines. And DAMPA means actually it's a solidarity of Filipino poor, and it's a network of the networks, and they have about 67 grassroots women network as members, right? And so Josephine also has been working with the communities for very long, and she is also a very strong community leader. So we would like to hear from you, Josephine, now. The floor is yours.
Josephine, you're on mute. You'll have to unmute yourself.
Sorry.
Okay.
So I'm so sorry. Thank you, Lanjana. So good evening, everybody. Just call me Jokas. So I'm one of the leader and founding organizer of DAMPA, or Solidarity of Press Filipino People, which is almost 25 years on the go for organizing grassroots communities. So I'm also one of the governing council member of Wairo Commission. And one of the big problems, especially during pandemic and because of climate change, is water. So in the case of Metro Manila, it's very difficult to access safe water to drink, especially if you are working, if you are living in an urban poor communities. So what we did as an organized grassroots organization nationwide, uh, we, through Wairo Commission and Swedish International Development Cooperation Agency, through this Community Resilience Fund, how we do to have safe water to drink. We organize our grassroots communities, especially in Manila. We call that PCRMY in Binondo, Manila, which has 350 families living in that community. And then we do local to local dialogues with the barangay officials in the barangay level, in the municipal and city level, as well as in the Congress level, so we can access funds to help to have this potable water to drink. So we also do savings mechanism. So in this process, through savings, and then it was leveraged by the congressman, we build this community. We call this communal water cooperative. So this water cooperative was organized way back 2010, and it is still existing until now. It is managed by the Grassroots Women Organization, and our present president at this time is the president also of this local organization, and they are the one managing the water cooperative, and it helps a lot to their communities, to the communities of the community, especially in building infrastructure inside the community. So through water cooperative, through the savings from the water cooperative is used for education of the members of the organizations, and it is also used in the infrastructures, building like drainage and canals inside the community. And especially in the COVID lockdown, if you can see this picture, it is one of the project inside our community in Manila, wherein the women are the one who are managing in constructing drainage and canal, because if you can see, it must be clear and it must be rebuilt. So during lockdown, the savings from our water cooperative was used in food security. So through savings and the water cooperative, our community bought foods like rice, sacks of rice, and then meat, vegetables, and it was distributed to the members of our communities. So it's a big assistance for family inside our community that they have already, safe water to drink, and it can also help for food security as well as for their income generating projects, because in our water cooperative, we have water tender who deliver house to house of the water, in which they can earn like 300 to 500 pesos a day through water tending. If you can see, this is the sack of rice that was purchased by our president, the president of Dampanao, Patricia is that in that car, and then they purchased rice, so it will be distributed to our members inside and PCRY Pacomna in Manila. So through this process, through water cooperative, it's a big assistance to the communities to work for other issues and concern inside the communities, not only the water but also the food security. So but And you can see our members inside the community. They are, that's the pictures where they are distributing the foods, the rice. So that's why they have, if you can say it is not water which is distributed, it is, the rice. Every family can avail like 15 to 20 kilos of rice. And it is from the savings of the water cooperative. And, this is not only a very easy process, but through partnership with different government agencies, we success to have this water cooperative. Because, our congressman, we access like almost 1 million leverage from them, so that you can build the pipes from the main pipes of the water going to the community. And it is because our partner trust. So it's very important that as grassroots women, because we are already organized, we need to be recognized and to be trusted by partners in terms of community development, so that whenever you need to develop our communities, it is us who must be consulted, not the people outside our communities, because we know our issues and concern. So all we need from our partners, from the different development agencies, is to trust us to manage the projects and programs that they want to be developed in our grassroots communities. So I think it's also very important that we need also to organize our grassroots communities, and our partners must help on this. And we are also very lucky that we have Wire Commission and Swedish as partners. That's why we use the community resilience funds in organizing and partnership and strengthening our grassroots communities. Thank you.
Thank you, Jokas. That's so wonderful. So you actually talked about, how the communities are managing and how they are addressing their own issues in partnership with the government and other donors organizations. So probably without that, it would be really, really very challenging. Although the situation is already challenging, but the people have actually found out their own way, by establishing their own groups and addressing the issues in various ways. Thank you very much for sharing this, Jokas. And now I would like to request Murli to make a presentation. Murli, are you around? Murli, I don't see you here.
I'm here. Can you hear me,
Okay,
Lajana?
right now. Okay, I can see you. Okay, so the floor is yours. And Murli is the founder member of MARI, NGO, Modern Architects of Rural India. And he's currently a regional convener of Freshwater Action Network South Asia. So Murli, please go ahead.
Okay, good evening, everyone, from the city of Hyderabad in South India. I would like to begin with a word of appreciation to all the organizers for hosting this very interesting Policy Lab series. I'm glad that it has very much emphasized on the wash needs of the urban poor, which is also a very important area of focus for us in Freshwater Action Network South Asia, which is a collective of civil society organizations from 8 countries across South Asia. I would also like to congratulate all the previous presenters and panelists for making the wonderful, insightful presentations. It was really very interesting kind of ideas, views have been already shared. I'm going to touch upon a subject which has not been touched upon so far. I would like to use the next few minutes of time allocated to me to particularly highlight the linkages between the solid waste management and the lives of the urban poor. How basically the solid waste management in urban areas is linked to the well-being of the poor. That is what I'll be talking about. Solid waste management is already a significant concern for the municipal governments across South Asian countries. It constitutes one of their largest costs, and the problem is growing year after year as the urban populations continue to swell in the entire region of South Asia. Solid waste management is affecting the lives of the urban poor mainly in three ways. You can see the urban poor as the constituency which is denied of waste collection and waste management services. The status of solid waste collection services available for the urban poor, mostly living in informal settlements with high density of population and poor level of other basic amenities, has direct impact on the quality of life and living conditions of the urban poor. Secondly, as many of you know, the major contribution of working force, the sanitation workers who are involved in waste management, basically come from the poorest neighborhoods, informal settlements of the urban areas. This is the fact across all the South Asian cities, towns, and urban areas. The waste collection, transportation of the waste, management in the sense sorting of the waste, recycling, and also composting of the waste. All these management processing operations are handled by the workers who essentially come from the poorest neighborhoods of the urban areas in South Asia. And the work related to waste collection, transportation, management determines the poverty level, the income level of these people who are living in informal settlements, their health conditions, their quality of life. All this is very much linked to the overall conditions in the area of solid waste management in urban areas. The third dimension of the urban poor and waste management in urban areas is the habitats of the urban poor are polluted by the waste produced by the urban areas. The urban solid waste dump yards, transfer stations, stocking points of the waste vendors, waste management and recycling units are invariably located closest to the habitations of the urban poor, which obviously affects the quality of air, water, and all other living conditions in the poorest low-income settlements and urban areas. And also in most cases, we see these conditions, the denial of service, poor as waste collectors, and also waste dumping and processing operations affecting the habitats of the poor. We see these conditions in an overlapping manner, and thus these conditions more deeply affecting the living conditions of the poor. So I would now like to elaborate on how the civil society organizations, because I belong to a civil society organization, in collaboration with the urban local governance bodies, private sector, and other actors, can build the community-led mechanisms to address the issues which I have just mentioned. I think number one, to be able to improve the services through community-led approaches, the primary focus, from my experience, should be building the community champions on the significance of solid waste management and how is it really affecting the lives of the people living in the informal settlements, and also making them aware of their rights and entitlements. What is the particular urban municipality or municipal corporation has committed in terms of waste management services for the people in general, and particularly for the poorer sections in the informal settlements. That should be known to the people in the informal settlements. That's how we should be creating the community champions. And also they must be involved in a kind of participatory assessment process to understand what is the current status of waste management in the informal settlements. And that must be contributing to generating reliable evidence on the status of waste collection services. And this should be very systematically documented. I think to be able to bring about the change, from my experience, this is a very essential kind of first step. And then making use of the evidence gathered to represent to the local authorities. The community champions should be facilitated, enabled to represent the issues to the local authorities. These are the commitments made by the urban municipality or corporation, whereas the actual situation with respect to waste management in our localities is this. So we demand our entitlements to be fulfilled I think that kind of representation, petitioning is also something very important in my experience that has worked in terms of sensitizing the decision makers about the waste management related issues in the informal settlements. And third is, I think I am also keeping in mind the problems, challenges encountered by the waste collectors. I think if their life has to be made easy, if their profession has to earn better income to them, I think the entire society in the urban areas must be made aware of the importance of waste disposal approaches. I think in most of the urban areas in South Asia, there is no segregation practice. People are not segregating wet waste, which can be composted, dry waste, which can be recycled, and the hazardous waste to be separated. I think this kind of practice is still lacking in most of the urban areas. Even if there is practice, it's only limited to a small percentage of population. I think unless people in general in the society change their habits with respect to waste disposal, I think the life of the waste collectors cannot be improved. So I am saying that the awareness, education, motivation levels of the people in general has to be improved to be able to improve the conditions of the urban poor, particularly the waste collectors coming from the urban poor background. And also, there's a lot of negotiation process, between the informal settlements and, of course, the urban local bodies of governments. Not only that, I think even the residents' welfare associations. In most cases, residents' welfare associations refuse to cooperate with the waste collectors. When they go for door-to-door collection, they somehow are under impression that the municipalities are paying good salaries to the waste collectors. But whereas the fact is that these waste collectors simply survive on the door-to-door collection charges paid by the residents, and whatever useful waste, recyclable waste, they can sort and sell it to the scrap vendors. I think these facts must be made known to all the people, and that is the kind of negotiation process required between the waste collectors and the Residents' Welfare Association. And the scrap vendors, they also exploit the rack pickers, waste collectors in a very generous way. I think making the waste collection trade very fair and just to the people who are at the lowest rung, the waste collectors and rack pickers, is also something important, which we have tried in my own work, and that has really helped in improving the living conditions of the waste collectors and rack pickers, etc. Also, I think nowadays most of the
sorry for coming in. Just 1 minute remaining for you.
Yeah. I think other important thing is cities and corporations are now coming up with these city waste management plans, but hardly there is any focus for the integration of the rights and needs of the waste collectors. I think that is an area where we need to do a lot of advocacy work. And also, last point I want to mention is that the urban management plans should designate space for smaller recycling units of the waste. Otherwise, the value of the waste is becoming zero if it has to be transported to long distance where where the recycling units are located. That is how the interests of the people, waste collectors and waste sorting people, waste recycling people need to be protected in the urban management. This is another area where a lot of education and sensitization and advocacy work need to be done. That's where I stop. I think it needs a lot of new approaches, multi-stakeholder partnerships, innovative technologies to be able to really address the issues through which the waste management environment can be improved in the informal settlements, as well as the income and health and living conditions of the waste collectors can also be improved. Thank you.
Thank you, Morley. Thank you very much for highlighting the issues of the sanitation workers, waste workers, rack pickers. They are the most marginalized groups among the urban poor communities, and thank you for highlighting their issues. Now, I think we have 3 more panelists to make comments and remarks. We have Raman VR from WaterAid. He's head of policy with WaterAid, and he's also the national convener of Public Health Resource Network in India. We have Thomas Keir, and Thomas Keir is an American architect, but has been living in Asia for the last 30 years. And he's with Asian Coalition for Housing Rights based in Bangkok. And we also have Jagat Deuza. Jagat Deuza is the Executive Director of Community Self-Reliance Center based in Kathmandu, Nepal. And he's also the member of Land Issues Resolving Commission in Kathmandu. He is a well-known land rights activist in Nepal. So I will now, I'll go with Raman first. See, we have actually discussed, actually talked about the challenges that the communities have been facing in accessing the basic services such as wash and other facilities as well. So I would like to know from you that from your own experience, because you have been working with the in the policy sector for such a long time. So from your own experience, what do you think that, what policy interventions is required to improve wash services in the poor communities? What need to be different in this pandemic or post-pandemic period, so the safety and health of the poor people can be ensured?
Yeah, thank you, Lajana, for that question, because I think, when we talk about community approaches for wash services, especially in the COVID scenario, there are some, good examples set up by some of the towns that I can see as some silver lines, but there are also, as usual, the poor and marginalized sections of the urban locations are deprived as well in most of the locations. So, I mean, when I'm saying there are silver lines, that doesn't mean that the silver lines are there in all the cities. They are rare, but still, they are giving us hopes. So one thing, is about some of the challenges. So initially during the May, when the lockdown started in India, we tried to list down some of the challenges and then tried to prepare responses for what a urban local body can do. I'm sharing the link of a policy brief that we developed and a media article that we developed on this, which may be of use while people are even, second phase of lockdown or third phase of lockdowns are possible in many places, given the way the pandemic is going on. So one specific issue is that we need to redesign the water supply program specifically for the see, in the COVID, I'm coming from a public health background. So one of the important things is that COVID is having a concept of reverse quarantine to protect the most vulnerable people the most, and quarantine them, and then the others are put into risk in some ways. The risks are limited to these people. So similarly, a reverse planning process should be there, keeping the urban poor at the center of it. So wherein the community-led approaches should be, there are several kind of examples that is possible. So for example, in Delhi, community, wherever the slums themselves had started piped water supply prior to the COVID scenario, their kind of struggles were limited. Only in few slums we could see that kind of a situation. People try to call them model slums. I don't know whether there can be something called model slums, because we don't want slums actually. But yeah, in any case, nomenclatures are nomenclatures. So you can have that. And then in Bhopal, I could see that of Madhya Pradesh in India, Mohalla Samitis managed a lot of kind of issues in coordination with the municipal health staff and also municipal wash systems, and they could set up some of the arrangements well for water supply to be streamlined and all that. And in Bhubaneswar of Orissa, I could see that the state government immediately prior to close to February or so, they declared that the basic drinking water rights of the specifically for the urban poor, and started to provide 24/7 water services. So these kinds of things are important. That it gives us a hope that if governments want it, they can do it. The second thing is that if the governments are having the will to do things, there is a possibility that it can do things, although with limitations. In Hyderabad, I could see that the Bhakti Vikas Manch in Hyderabad, along with the Greater Hyderabad Corporation, they could do some specific initiatives. In Mumbai, I could see that there was a flooding situation after heavy rains in India at that time, in Mumbai at that time, and communities were joining hands with the government for addressing some of the issues. So there are several, Warangal in Telangana similarly, Lucknow in Uttar Pradesh similarly. So there are examples where communities and municipal authorities can work together on some of these issues. So I told about this reverse quarantine kind of a equivalent situation, maybe a reverse protection collection initiative for the most marginalized and vulnerable population? How can we initiate that? So one is, at the community level, how can we install some collection tanks for water? Because most of the water comes through the tanker supply, and the crowding around the tanker supply is a major issue that can jeopardize the preparations for physical distancing or hygiene or whatever. So wherein, if you can collect the water in a tank, and it can have 4 or 5 taps around the tank, and people can collect water with a distance maintained from that. That kind of a system, was tried in one of the places. We have suggested this in our policy brief as well. And similarly, for menstrual hygiene, what could be done? How can we enhance the community itself to have, some of the examples already came, to have hand washing stations across various areas? And menstrual hygiene improvement, how can we have both education and availability of systems and supplies? And then toilets, unfortunately, in one of the states of India, Karnataka, the expert committee suggested that the most, crowded and high footfall community toilets should be closed during the lockdown, which has led to a lot of difficulties for the urban poor. So how can we our experts can also be, even though they are coming from an elite background, how can they understand the pains of the poor is also something that, so our elites and our experts need to be educated about the lives and situations of the poor is one important, precondition for making a community-led approach at the urban poor settlements. So I would end with, the need of special budgets, although, we are going to talk about financing in the next urban policy lab. And also preventing fake information is a very important, measure, because of this new media, WhatsApp, etc. In the urban locations, particularly the poor are suffering with a lot of wrong information, and they are spending unnecessary money on those things. So how can we make a community media for, educating the people by themselves? It could be the, important measure. Putting up these, looking also at the time, I would like to end here. I can answer any further question. Thank you.
Thank you, Raman. Actually, I liked what you said, if the governments want to do it, they can do it. So I think our job is to create interest among them to do their job very well. So that's what the CSOs are engaged in doing, influencing and advocacy. I think that is very important. And thank you very much, sharing. So now I'll go to Tom. Tom, you through ACHR actually has been working in the poor communities in Asia with the groups for so many years, supporting them in improving their living conditions, in improving their access to wash facilities, housing planning, advocacy, and so on, right? And I would just like to know from you now, what is your experience? What do you think about your own work? What is your experience of working with the informal settlers and poor communities in the cities in Asia? And what are the key challenges you face now? And what do you also think should be the way out strategies so the communities can sustain their initiations?
Oh, thank you, Lajana. A lot of questions.
I hope you can give a short reply, short response. Because
I recognize that we're running out of time, and I was going to follow up on some things that Jokas was saying and give a couple of examples of what happens when a community process is invested in and can scale up, and how much you can do when a community process is supported. And one example was going to be our ACA program, which we did in Asia in about 220 cities with citywide upgrading and some housing projects, some upgrading projects, which included WASH programs. And it was funded by that's a donor-funded example. And in that program, the amount of money that was invested by the project in communities ended up being about 19% of the value of the projects that communities delivered. All sorts of hundreds of road paving, water supply systems, housing projects. And that's because the money was in people's hands, and they negotiated for their own contributions. They negotiated with their local governments to give land, to give money, to give materials, to give resources, to add resources to their community development funds. All these things could be leveraged because people were in control of it. So the ACA is an example of a donor-driven, scaled-up example of community-driven. And the other one I was going to talk about, I'm not going to go into details, is the Ban Man Kong program in Thailand, which is a government-supported housing and slum upgrading program that is completely supported by money from the government of Thailand. And it's now about 15 years old. And in the Ban Man Kong, they have now upgraded about 1,300 communities, which provide housing to about 120,000 families in Thailand. And in Thailand, that represents 1/3 of informal communities. So in Thailand, we have a case where 1/3 of the poor communities in the country have been upgraded. And upgraded means they have secure land, they have beautiful houses, they have community cooperatives which own or rent the land that they're occupying. It's like a full system. And it's a permanent solution to housing and poverty issues. Because what we see is that once people have done the housing projects and they've done the upgrading, they have this sense of power. And that's what Jokas was describing, that when people have the sense that they can do anything and that they're going to be supported, they can deal with COVID. They can deal with housing insurance. They can deal with welfare. They can deal with healthcare. They can deal with education, with elderly issues, youth issues, children's issues, education, you name it. The idea is that you have created in that strong community, you have created a boat which can float any issue and deal with it in the most efficient, the most pointed, the most appropriate, the most low cost, the most scaled up way. And both the ACA program and I think the Ban Man Kong programs really show that clearly. And I would just close by saying that this investment in the system, which is community delivered development, which can cover everything, it's being invested in very, very, very little. And I don't need to tell all of you this. I mean, everyone in this meeting knows this very well, but we can count the project, in most of our countries, we can count the projects that are getting donor funding or getting government funding for a little bit of community this, community that, a little few wash projects here and there. It's when you compare it to the need or compare it to the amount of stuff that's being done by big development agencies and government contractors and all the wrong stuff, which doesn't work. It's just a teeny drop in the bucket. And so I would finish with just a plea for us to find ways to plug for the community-driven mechanism, because this is the group that is most interested in fixing these problems because they're experiencing them themselves. The others are not experiencing them, and their interests are something quite different. So I don't want to sound negative, but I want to just emphasize that participation of communities is not enough. We need them to sort of lead the way, and they can, and we have proof now that it works. Thank you very much.
Thank you, Tom. Thank you so much. Actually, you again emphasized the need of community-driven process, right? And that need to be strengthened. And also, you also give a beautiful example of Ban Man Kong in Thailand and 1,300 communities upgraded, land secured. So that's wonderful. And I think there's a lot of things that we need to learn. We can learn from that experience. Thank you. So our last panelist is Jagat Deuja. Now, Jagatji, you are a part of the commission that actually is looking into the issues related to land, to resolve the land issues. And I'm just wondering, maybe you can explain, like, the role of the commission, the role of the land issues resolving commission in Nepal, contributing in improving people's access to water and sanitation service. So how do we see your own role so the people can have better access to services? Jagatji. Jagaji, I hope you are there.
Thank you so much, Lajna
Yes.
ma'am.
Okay, thank you. Yeah.
Yes, yes, yes.
Yes, please go ahead.
So, so thank you so much, Lajna ma'am, and all the organizers for providing me this great opportunity. Uh, just recently, the government has formed the land issues resolving commissions, and I'm working one of the I'm working as a member, and I do agree that the land lease, slum, squatters, and informal settlers are deprived from the basic rights, including proper sanitation and water, and many services, facilities, and rights are connected with the land tenure security. And in Nepal, we have around 1.3 million households as a landless and informal settlers. And after the so many local government to identify the informal your question, I will like to highlight some introduce number of policies and laws to resolve the informal settlers issues and add the constitutions, land tenure security and access to housing recognized as a fundamental rights. And in 2019, the government introduced a new land policy, and that policy also recognized the informal land tenure issues. And there are so many very good provisions to settle the these informal land tenure issues. And in 2020, the government also amendment the Land Reform Act and uh, allocate the some provisions to recognize the informal land tenure issues. And based on the Land Reform Act, the government formulated the land issues resolving commissions. And the formulation, the policy and laws is not enough. We all know there are a number of good laws in many countries, but not implemented properly. And this time, this land issues resolving commissions uh, working for working with community and the local governments to resolve these problems within 3 to 5 years. And this commission have developed the system and necessary guidelines to manage the work of commission as per the mandate. And for this, we try to include the learnings from the past commissions. And we have started the identification, verification, and recording of landless and informal tenure land holdings in selected municipalities. And we have a plan to start this work in 100 local municipalities in this year through participatory process in the leadership of local government. And we have a plan to uh, bring in the process the community people as well. And also we are also identifying the communities those are living in risk area through land use and hazard maps, and taken this process not only technically. We consulted and listened the experiences and knowledge of community people. So we are also going to identify the risk zone. Those are living the informal settlers. And we have a plan to provide the legal entitlements to landless and informal settlers if the area are safe and usable. And we will rehabilitate relocate in participatory way, in consultative way to other areas. And we're working for that and trying to coordinate the local level government and other development partners to initiate the housing schemes, including all the sanitation facilities, because the only providing the land tenure security is not enough. It is important, but we have to also ensure other facilities as well. And we are planning to provide the land in a planning way. So these are the plan we have, and of course we have so many challenges because we have a plan, we have a mandate to provide the land tenure security to 1.3 million within a maximum within a 5 years, and but we are hoping to cooperate from the other actors as well. And finally, I will say Nepal has introduced a groundbreaking policy reform to address the land issue of the informal settlers, and we have challenges and we have opportunities, and now we have local government, and we hope we will complete this task this time. And of course, land issues is such a big barrier. This keeps the informal settlements away from having easy access to any services, including water and sanitation. And we are working to address this challenge with clear vision and practical strategy. So thank you so much.
Thank you very much. Thank you for sharing the plan and work of the Land Issues Resolving Commission. I also think that, the new land reform policy we have and also the establishment of the commission itself is a very important milestone that we have achieved. So, and thank you and congratulations, right? And I hope that the commission will be successful in its work. So this is the end of the session 2, and we are running out time as well. And I would like to thank all the speakers, all the presenters and panelists for a wonderful sharing, for a wonderful discussions. Thank you all so much. With this note, I would like to hand over now to Subhagoto for his concluding remarks.
Thank you very much. I join you, Lajana, first in thanking all the panelists from the first session and this for the excellent presentation, the diversity but common themes that run through it. It surely is it is a turning point in how communities need to reassert their role in taking the development agenda forward. Given that the SDGs are going to be challenged, that there might be more the problem size might increase. I just want to, given that this is such a strong collective of community leaders, to also think among yourselves about how do you bring communities back in the center? What might be the role of networks? Are you seeing adequate traction? Is the accountability that SWA mentioned about? Do you see that already, or what additional networks or that needs to be built? And so I would also request you to please join the panel next on the 9th of December, which will be on WASH financing. And one of the key questions we are going to ask in that is that given all this post-COVID recovery approaches that the nations and multilaterals around the world are going to be engaged in, what is it that they are particularly carving out? Are we accounting right to understand how that distribution is going to work? It was a thoroughly exciting diverse and rich presentation. We are very thankful to you, Lajana itself, for putting together this rich session. I will have to conclude this. Unfortunately, that job that is mine. But look forward to seeing you again on the 9th for following this conversation on. and good night to people in Manila and Bangkok, and good morning to you in Guatemala, and good evening to South Asia. Bye then.
Bye. Take care, everybody.
Bye. Thank you very much. Thank you all.
So long.
Bye-bye.
Thank you, everybody. Bye-bye.
Thank you. Bye-bye.